Hi, welcome to today's video on comments on psych meds by a psychiatrist. Today I'm going to be reviewing Zoloft, generic name sertraline. This is another medication that's in the class of antidepressants known as SSRIs, or selective serotonin reuptake inhibitors. I've already reviewed Prozac and Lexapro in this class, and there are a few more, which I will get to. But today we're going to talk about Zoloft. So, as I mentioned, it's in the class of medications known as SSRIs, and these medications are used to treat depression as well as a variety of anxiety disorders. Even though it's known, or the class is known as an antidepressant, as I mentioned before, they're equally good for certain individuals for certain anxiety disorders, and they have FDA approval for these conditions. The dose range for Zoloft, and this is the thing that I want to emphasize because I see a lot of patients who said that they've been treated with Zoloft, that it didn't work, but they are not and have never been on what I would consider a sufficient dose. So the dose range, generally we start patients on 50 milligrams and then increase from there 50 milligrams at a time, I would say usually. I would say the absolute minimum dose that I would consider the effective dose is 75 milligrams, but I really like to make sure that somebody has had a trial at 100 milligrams before I consider it a medication that's not going to work. And as I said, I encounter a lot of people who got Zoloft from their primary care doctor, started at 50 milligrams, never increased it, and then having no response, just stopped it thinking that it didn't work. And as I said, I think 75 is the absolute minimum, but getting up to 100 and even pushing to 150 or 200 if you don't get a benefit at 100 and you have no side effects, I think it's worth pushing the dose. I have patients go higher than 200, as high as 300. Basically, these medications, you are safe to go higher until somebody has intolerable side effects. If you have benefit, you can keep pushing the dose beyond 300, but I think if you have no response, even at 200 for 8 to 10 weeks, I think you can consider that a medication failure at the very outside range. But we hope to see a response sooner than that at the lower doses. So to sum up, the dose range is from 50 all the way up to 300 and beyond, but really in the 100 to 200 range. And I think you really need to take 100 milligrams for at least 8 to 10 weeks before you can absolutely rule it a medication failure for Zoloft. Coming off of Zoloft, it is not one of the more notorious medications for withdrawal, but as with all medications, whenever possible, I recommend tapering it gradually. That can be done, again, it depends on the individual patient, but usually a week to 2 weeks at every increment is more than enough to get people off of it. People have reported withdrawal symptoms especially when suddenly stopping it. Things like a brain zaps or zaps in the fingers or tingling. Other flu-like symptoms are common when stopping an SSRI for the people who do have side effects. When I say common, I think most people tolerate coming off pretty smoothly and well without withdrawal effects, but I have heard them reported. So actually not terribly common, but some people do have them, and you can minimize that simply by doing a gradual taper. So the side effects with Zoloft, as with all the SSRIs, the most common issue are sexual side effects, so reduction in sex drive or difficulty maintaining an erection for men, difficulty getting to orgasm for women. As I think I probably say in every video about this, is that it is common in that about a third of patients have sexual side effects, but that means that 2/3 or twice as many don't have any sexual side effects on the medication. So it's common, but not at anywhere near a guarantee that this is going to be an issue. There are other possible side effects with Zoloft. I will highlight people sometimes develop sweating, either night sweats or just generally sweating excessively when taking Zoloft. There are antidotes for that. Actually, a medication I'm going to talk about in a future video. And then some people get diarrhea taking Zoloft. I usually will switch patients onto a different SSRI if that happens, as it's clearly a unpleasant and inconvenient side effect to have. So there are, of course, other side effects, but these are the main things that I encounter. And that is what I have to say about Zoloft.